Hi, this is Congressman Paul Ryan. I want to say congratulations to WHIO on its 10th anniversary. Over the past decade, WHIO has been a tremendous partner as we've worked to improve the quality, affordability, and efficiency of healthcare in Wisconsin. Through its training programs, analytics, and consumer outreach, WHIO provides detailed healthcare information that can help businesses' bottom lines and that can help people make better healthcare decisions. Congratulations on a successful decade of improving healthcare in the Badger State, and I look forward to working with WHIO in the future.
In 2003, I joined the governor's cabinet, and at that time, everybody was concerned about high cost and uneven quality of health care, and we knew we needed better information. However, people did not agree on what information, who would collect it, and how to use it. So, the legislature had mandated a physician office visit data reporting system, and physicians hated that idea. They said the data reporting was a burden, fees were a burden, and it wouldn't be useful to anybody anyway. Governor Doyle agreed and asked the legislature to drop the mandate, but the legislature did not. So we had a stalemate. And that stalemate actually was the opportunity that led to the creation of WHIO, because many of us from state government, healthcare providers, purchasers, payers started meeting to say, what's a better approach? Trustworthy data, useful to all. And that led to WHIO.
The vision for WHIO was about creating a database that we could get cost data on providers in the state of Wisconsin. We had quality data at the Wisconsin Collaborative for Healthcare Quality. What we were trying to do was build a value performance measure set. We need both cost and quality to develop that, and that's why we built WHIO.
When I got the call that the job of leading WHIO was mine, I was both excited and scared to death. Had never done it before, didn't really even understand exactly what it would be. And honestly, had I understood it, I'm not sure that I would have been as excited at that point. It was just so much of not knowing and so much of learning on the job. So we were making things up as we go. And there were a lot of different agendas at the table, all with one purpose in mind, which was to create this statewide database, but with very different opinions about how that could get done, how it could be funded, who would be decision makers, how all of those things would be done. And so the real work of the first years of WHIO was establishing that piece.
I wouldn't say it was simple. I think there was trust that had to be built over the years, particularly the first year. I think people were concerned that there were different agendas in the room, but in fact we agreed on a common vision that we should have an all-payer claims database for the state of Wisconsin.
Truthfully, they were all very easy to work with, and even when tempers would flare, there was a real dedication to doing the right thing. And I can even remember instances where they would kind of push back from the table in a heated conversation, say, okay, all right, let's take a 5-minute break. Remember, it's the right thing to do.
By the time I came in as chair, some of the initial mistrust issues between providers and insurers had been mitigated somewhat, but we still needed to continue working on that. In addition, we had challenges of financial viability. We had challenges of getting additional insurers to participate in the program, and we had issues of data usability to make sure that the data that was coming out was usable by the people who needed to use it. We made great progress on many of those things, but probably the greatest success of all was that we were still in business and able to make great progress toward becoming that model data repository for the rest of the country.
Our first challenge when I came in as chair was to replace Julie Bartles, who was our original executive director and who had done such a fine job in developing WHIO. Joe Musser became her successor and has also done a terrific job with this organization. Our second challenge, as I saw it, was financial sustainability. And we are a multi-stakeholder organization. We don't rely on the state for most of our funding, so we have to do things to make things work financially. Part of that success, I think, was in fact making a decision to hire staff analytical support to build analytical resources, and we hired Sarah Jensen, who is a super individual who trains the folks who buy our data how to use that data and to see the power of our data mart.
The focus of my chairmanship is getting the Medicare data into the data set so that it's a more robust data set. And number two was to have the WHIO data set go public. So we've accomplished those two things with myhealthwisconsin.org, and we became a QE, or qualified entity, with CMS to be able to get the Medicare data. In addition, we brought in a new logo, and we were able to make the WHIO organization more public, and its presence is out there today, where I feel very comfortable that WHIO is in a better spot than when I started my chairmanship. And as I welcome the new chair in, Linda Scythe, I will tell you that the WHIO dataset's in much better shape, and the focus needs to be on how do we expand our subscribership.
The Alliance is a cooperative of employers and insurance trusts who share a commitment to value-based purchasing. For us, being able to compare the performance of hospitals and clinicians is fundamental to value-based purchasing, and WHIO is a mechanism by which we're able to accomplish that.
So I think one of the unique things about where WHIO is going with its data, it's really involving providers. So it's not a black box. Well, the value of physician involvement in the WHIO database is that physicians will actually engage and use the data. So to the degree that the physicians can understand the data, they can convince themselves that it's relevant to their practice, and they also can have input into sort of what the data looks like, which is where WHIO has gone with the Physician Advisory Committee. Physicians really will engage with the data, use it to really improve care.
Humana is proud to be a founding member of WHIO because both Humana and WHIO believe in keeping patients, consumers, at the center of care. WHIO has the great history and the great future of being able to provide cost transparency as well as tools to help consumers engage and be active in their healthcare.
We fortunately just got legislation passed in March, which allows us now to access the entire Medicare claims database. So the next step is to integrate the Medicare claims data with all the commercial claims data in the state. When we do that, we'll have, the majority of the claims on the residents of the state of Wisconsin in one database. Now we'll actually be able to do much more robust and sophisticated analysis across providers and provider groups so that they can actually understand where the opportunities for improvement are.
I cannot believe what has happened in 10 years and that WHIO is celebrating its 10-year anniversary. If you think at the beginning of just the concept of bringing all this data together, and now we're on Data Mart version 13, and at this point you have so many stakeholders that are at the table working together to improve the quality and efficiency of the care of the patients of Wisconsin. I'm very excited that moving forward we can look at that data and improve both quality but really the efficiency of care so that we can make sure everybody's getting the right care at the right place and the right time.
Hello, I'm United States Senator Tammy Baldwin. I am delighted to share in WHIO's 10th anniversary celebration. The Wisconsin Health Information Organization truly demonstrates how stakeholders of varying perspectives and backgrounds can work together for the benefit of all. I applaud WHIO members for your spirit of collaboration and the improvements in quality, efficiency, and transparency of healthcare it creates. Earlier this year, I introduced bipartisan Medicare data legislation with the help of WHIO's long-standing support for the bill. The Quality Data, Quality Healthcare Act would provide access to Medicare data and put it into the hands of those who can best use it, helping doctors make more informed decisions and improving how we deliver health care. I'm happy to say that Congress overwhelmingly voted in favor of the reforms that were modeled after this legislation. This success would not have been possible without the help, guidance, and support of WHIO leadership. Thank you so much for your support, and I look forward to continue working with WHIO to transform healthcare in Wisconsin. I am proud to be your partner in the United States Senate.